Hey everyone, welcome into another Webinar Wednesday. Today we'll be talking about how to qualify for an OWCP Schedule Award, which is why I have brought in Nick and Leah. Nick is the Director of Client Experience here at the firm, and Leah is our Associate Attorney who handles all of the appeals processes for our clients. But before we get started, take a look at the bottom right-hand corner of your screen and you'll see a little chat box. We have members here live right now answering any and all of your questions, so please feel free to write those in the chat and we'll get to them as soon as possible. Now, a quick disclaimer here. It's important to remember that this presentation is provided for informational purposes only and does not constitute legal advice. Here at Harris Federal, we strive to put out a bunch of content that can help educate federal employees just like you on all of your federal benefits. So now, take it away, Nick and Leah.
Well, thanks, Elizabeth. We're really excited to be here today and talk to you guys more about OWCP and specifically schedule awards. And as Elizabeth said, I'm here with Leah Killey, our associate attorney. Leah, thanks for being here. We're excited to talk to you.
Of course, I'm so excited to be here as well and to tell people about their benefits and their rights. A lot of people don't get this information directly from their employing agencies or workers' compensation. It can be a little hard to find.
So I'm really excited to do this one with Leah because you guys will definitely hear her expertise on the subject and her insights, and these are always fun to do with her. So today we're going to be talking about a few different things, mainly what is a schedule award. And that'll be the focus of it. And we're going to look at some other stuff surrounding OWCP, what some of those numbers look like being on the benefit. And then we're going to look at this in relationship to federal disability retirement, which is what we help a lot of clients with here, and how those can work together to benefit you if you're in that situation. So without further ado, let's talk about understanding OWCP. So can you give us the high-level view, Leah?
Yeah, so OWCP is the Office of Workers' Compensation Programs. It's the agency that manages federal employees' workers' compensation benefits. It's under the Department of Labor. When a federal employee has an accepted workers' compensation claim with OWCP, there are three main benefits that they can receive. The first one that a lot of people think about is wage loss benefits. This is a monetary benefit that is a percentage of the person's salary that they receive while they're unable to go to work due to the accepted work-related injury. Now, it's a percentage, so if you have dependents, I believe it's 75% of the lost wages. If you're single with no dependents, it's 66.66% of the normal wage loss amount. Medical coverage is also the second big thing. We want to get your doctors paid. So when you have an accepted workers' compensation claim, OWCP will pay your providers directly, no copay or anything like that. But it's just meant for the medical treatment for the accepted work-related injury. There will be some ICD-10 codes that are accepted depending upon what your injury is, and the billing from the doctor needs to match up to that specific ICD-10 code. And then lastly, and what we're going to be talking about today is a schedule award. That is a payment due to a permanent impairment from the accepted work-related injury to a body part that's covered by workers' compensation. A lot of people, when they think of schedule award, this is what they think of as the settlement. Now, technically, there is no settlement for a workers' compensation claim under the federal system. It exists as long as the injury exists. But the lump sum that people think about, that's what the schedule award is.
Gotcha. Yeah, let's dive a little bit deeper into that because I think that is where people get confused when they think of this as a settlement. So let's dive deeper into what is a schedule award.
Yeah, so the schedule award, again, is a payment to compensate the employee for permanent loss of a body part from the accepted work-related injury. They only get this when they've reached what's called maximum medical improvement. And the way it's calculated is the person gets a percentage assigned to their particular injury from that body part, whether it's, 1%, 10%, 20%, et cetera. That percentage is then applied to a table of body parts, which sounds a little creepy, but there's a list of accepted body parts. And then from there, that is multiplied by their weekly compensation wage loss benefits. Now, again, when I say there's a table of body parts, not everything is on this table. Certain body parts are excluded. The really big one is back. Your back is not included at all. It needs to be usually to an extremity. Some organs are covered, some are not. Some things are broken down. So there's, an upper extremity, but there's also, different fingers. I think the thumb is worth the most as far as amount of time. So you have to look at that schedule of body parts to see if your particular injury is covered.
So yeah, with those exclusions, I'm sure a lot of people are kind of frustrated that, your back and spine aren't included in that. And there's a lot of different reasons for that. But one thing I want to point out is that those injuries can cause other impairments to other extremities that can be covered under OWCP.
Yes, that's correct. So, for example, if you had, a neck injury, if it's causing symptoms and issues into your upper extremities like cervical radiculopathy, potentially, if the cervical radiculopathy is an accepted diagnosis under your workers' compensation claim, then yes, you could go for an upper extremity impairment and not, miss out on some money.
Yeah, so that's really important for people to understand. Another really important concept for people to understand is MMI right here, so maximum medical improvement. And this is really important because OWCP is trying to compensate you for your injury, but they ultimately want to get you back to work, right? So this maximum medical improvement, can you talk to us a little bit about that and what that looks like, especially in terms of a schedule award?
Yeah, so like you said, it's a foundational concept in workers' compensation cases. Workers' compensation is not a retirement benefit. They do want to get you back to some form of work, even if it's not with your original federal employing agency and your original federal job. So when you reach maximum medical improvement, that's often, what workers' compensation is looking for to do other things like vocational rehabilitation. But maximum medical improvement is also really foundational for the schedule award. You cannot receive a schedule award until you get your maximum medical improvement. And that has to come from a physician. So your doctor determines when you reach maximum medical improvement. And it's not meaning that you won't, get a little bit better maybe throughout the years or get worse throughout the years. It's kind of, you've reached a general plateau of your injury. You're not expected to improve vastly, even with additional medical and treatment. But you're also, your condition is not dynamic anymore where you're expected to, the next weeks have a bunch of more severe symptoms.
Yeah, so we've done the therapy, we've done surgery, we've really gone by the doctor's orders, right? And now we're at a point where we're like, this is as good as it's going to get. And we might still need to maintain with some physical therapy or those types of things. But what we're saying is this is the most full function that extremity or appendage is going to get based on your doctor's perspective.
Yes, that's correct. And keep in mind, it can be in the past. So if you're thinking, man, it's been about, a year and a half since my surgery, hopefully I'm at maximum medical improvement now. You probably are. In fact, your date of maximum medical improvement may be retroactive and backdated by your doctor to maybe 12 months out from the surgery. So some doctors like to say, as of that date, others will backdate it. Just know if you think you've missed your mark, you haven't, you can go into the doctor.
Gotcha. Okay. So let's look real quick at the schedule. So this is what Leah was talking about before, where it is kind of creepy to see all the body parts listed on here, but this is what they are going to base a schedule award off of. So what you're looking at is all of this based off of 100% impairment rating, as you can see at the top. So once you receive your impairment rating from your doctor, this is what you'd be looking at, right, Leah?
Yes, so they go off of a percentage, and then that percentage is applied to however many weeks that body part is worth. As you can see on this schedule, we've got a number of body parts listed. Keep in mind that's at that 100% rating. So if you had like an amputation, most people are not going to get that 100% rating. It will be lower than that, but it's based upon these numbers.
Okay, so let's real quick look at what a calculation would look like, just to give people an example. So if you could walk us through this math here, Leah, that'd be helpful.
Yeah. So for easy math, let's keep it simple. Let's say that you had a workers' compensation injury that caused deafness. Maybe there was you're a mechanic and something, has gone awry and you have hearing loss, permanently in your death. That's paid out at a total of 200 weeks of your wage loss benefits. And let's say that you were having an augmented weekly pay of 1,500. Let's say that that's the 75% of a person's, wages. So they would get that $1,500 multiplied by the number of weeks, 200 if they're at 100% impairment for that type of injury. And they're looking at a schedule award of $300,000.
Yeah. So if they have a 50% impairment rating, we're talking about half of this number, right?
Correct. So if they had a 50% rating, the 50% would be multiplied by the number of weeks paid out. So instead of 200, you'd get to 100. But you'd still multiply it by the same weekly compensation that specific person is receiving.
Gotcha. Okay. So hopefully that clears it up. Now, you might be thinking, okay, this is interesting. This could really benefit me. Am I eligible for it? So can you walk us kind of through the eligibility requirements there?
Yeah. So eligibility, biggest thing, you need to have an existing and an approved workers' compensation claim. So you've had the workers' compensation injury, you filed for it with the Department of Labor, OWCP. They've accepted it and said, yes, we do think that's work-related. Then from there, you need to, reach maximum medical improvement, and you need to receive an impairment rating under the AMA Guides 6th edition. A doctor will perform that rating who's familiar with the 6th edition. And from there, you would submit a CA7, but instead of, checking the box for wage loss, there's a box specific for schedule award that you would submit. Now, keep in mind, that's just for the workers' compensation schedule award. You may be eligible for other benefits under workers' compensation or with other programs.
So yeah, like Leah said, there are other benefits in your federal benefits package that you can qualify for. Like we mentioned earlier, OWCP should not be looked at as a long-term benefit. While it can be for some people, in most cases it's not. They're trying to get you back to work. So ultimately this ends up being kind of a short-term benefit for a lot of people. What a lot of federal employees might not know is that there are other benefits in their package, like federal disability retirement, that aren't that well known, that can be more of a long-term benefit, that can be used in addition to workers' comp once it runs out, and or with the schedule award be added on to that. So let's learn a little bit about this as well. So federal disability retirement can help any federal employee struggling to work due to an illness or injury. Specifically, this illness or injury does not have to be caused by your job. So whereas federal workers' compensation does have to be a work-related injury, federal disability retirement does not. So this can help people that have a condition that's worsened during their employment. So for instance, someone that had PTSD coming into their employment and that got worse with their employment, that can help them. Someone that had a physical injury that got worse during their federal employment, it could help them. And so while we're talking about this being a long-term benefit, is because this essentially allows you to retire early. So let's look at what the benefit highlights are for federal disability retirement. So this benefit offers a monthly annuity. So this would be paid out to you monthly based on your high 3 average. It offers credible years of service. So any time that you are on this benefit, they're going to get tacked on to your current service amount once your regular retirement recalculates at 62. You can go work in the private sector, and this is pretty unique because most disability benefits do not allow you to continue working. And so what we're trying to show here with federal disability retirement is not that you can't work any job, you just can't work your specific job in the federal government. And it also goes on to pay health and life insurance. Leah, is there anything I missed there that we need to go into further?
No, I think you did it pretty well. Let's get into who's eligible.
Okay.
So like you said, this is a benefit for federal employees. So if you're not a federal employee under the Federal Employees Retirement System, it's not for you. You also have to have some other requirements. You need to meet 18 months of creditable service under the federal employees retirement system. And you need to have become disabled because of a disease or injury. And again, does not have to be work related. So could be you get a diagnosis of cancer. And so you need to be disabled from your particular federal position of record. So you look at your SF or PS 50 and see what your specific job title and job duties are. You need to show that you're disabled from that specific job. So it may be a bit harder to get disability retirement for someone with a sedentary position versus someone that has a very physically demanding job. They may be able to qualify with a lesser injury.
Gotcha. Yeah. So let's talk about those injuries real quick. So we have physical injuries and mental conditions. A lot of people just think of a disability as a physical injury most of the time. But let's talk about what that looks like on disability retirement. Who can get approved for this?
Yeah, it's any diagnosed condition. It could be actually be an undiagnosed condition. We've had a client before which he didn't have a specific diagnosis, but he did have disabling symptoms. It's just he had a really complicated case and the doctors couldn't figure out what exactly was going on with him. And like you said, it could be physical or mental or a combination thereof. Really, you can list any of your medical conditions on your application for disability retirement. A lot of people we see do have a combination. And that's often because if you've got physical ailments, a lot of time that is impacting your mental health or vice versa. As long as you've got these medical conditions which are disabling for your particular federal job, that's what you move forward on an application with.
Yeah. And when Leah says that are disabling in your job, what we're talking about is just one aspect of your job that is considered one of the main tasks required to do your job, right?
Yes, they're looking at your specific job and its essential functions. So a letter carrier needs to be able to, walk and deliver mail versus a federal air marshal needs to be able to, apprehend suspects. An IRS employee may have to sit for prolonged periods of time, do a lot of computer work, have, a high mental capability to perform that work for prolonged periods of time. Each job is unique, and then you have to use it in combination with that person's unique medical conditions and symptoms.
Yeah, so that should give you the overview, the very basic overview of what federal disability retirement is. We're not going to go into the depths of it in this webinar specifically. We have lots of other resources around federal disability retirement. But why we wanted to bring it up here is we wanted everyone to be aware that OWCP should be viewed as a short-term benefit. And like I mentioned, it can be long-term, but in most cases, it's short-term. And your injury must be caused by a work-related injury. And on the flip side, over here, you have federal disability retirement. That should be viewed as a long-term benefit. And while it can be caused by a work-related injury, it does not have to. So these two benefits could work together for you, especially if you're talking about receiving a schedule award and federal disability retirement. You can receive those two things at the same time. You can't receive wage loss and federal disability retirement at the same time, but you could be approved for both at the same time and just utilize one as you need it and put the other, specifically federal disability retirement, on the back burner per se, as a backup benefit when your OWCP runs out. So what we're really trying to say there, though, is that the important part and why we brought it up in this webinar is that if you have a schedule award, you can also receive federal disability retirement concurrently.
And one other important thing to note is, the timing of these benefits. Specifically for workers' compensation, we talked about those three main benefits you can receive. Specific to wage loss and a schedule award, please understand that you cannot receive both of these benefits at the same time. You need to elect which one you're going to receive. It's usually the most financially beneficial to run out of your wage loss benefits, go back to some type of work and have it reduced, or be on a retirement program and then get the schedule award. If you were to elect a schedule award while on wage loss benefits, you'll get it. It's just they'll reclassify your wage loss benefits as the schedule award.
Okay, so now what we're going to do is we're going to look at what these two benefits look like when they can work together. When you have that OWCP schedule award and you also have federal disability retirement that you can utilize. So First, we're going to look at a federal employee, this example federal employee named Jacob. Jacob is a letter carrier with the USPS. He's 47 years old. He has a salary of $62,000. He has 15 years of fur service, and he is married with 2 children. And the dependents factor into the calculation here. Leah, can you talk to us about his injury and then what that would look like when we're talking about calculating the schedule award?
Yeah, so let's say that Jacob, while on the job, severely injures his leg. Maybe he falls down some stairs. Maybe there's a dog bite attack. Maybe he, just trips and severely twists something. Either way, we're going to say that he severely injures his leg while working at the post office. He files for workers' compensation, has an accepted claim. They accept his injury. He's receiving benefits. He has surgery or physical therapy, both, gets to a point where he's reached maximum medical improvement and he's looking at getting a schedule award. He goes out and let's say that he gets a rating of 20% under the 6th edition AMA guides, and he's not able to return to full duty. Maybe he could, do some work somewhere else. So workers' compensation is looking to either kick him off of wage loss benefits or reduce it, and he's looking to maximize his benefits for that schedule award. Let's say he goes after the schedule award of 20%. So you would apply the 20% to the accepted work-related injury. Here we're saying it's his leg. The lower extremity, if it were 100%, is worth 288 weeks. Since we're doing 20%, we'd multiply 20% to the 288 weeks. And then we also need to look at his particular salary, right? He's married with 2 kids, so he has dependents. So when he receives benefits from workers' compensation, it's at that 75% rate. So we would take his salary of $62,000 and multiply it by 75%. From there, we would take that amount and multiply it by the 20% of the 288 weeks, and he should get a total of $51,507. Again, by breaking down $62,000, do 75% of that, multiplied by the number of weeks he gets for 20%. 20% of 288 weeks is 57.6 weeks. And we get to that total of $51,507 for his schedule award.
Okay, so lots of confusing math, but hopefully you can see what we're talking about here with the schedule award. So now we're going to be talking about that same example federal employee, but we're going to be looking at federal disability retirement and what he could potentially get if he's approved for that benefit. So now we're going to be talking about his high 3 average, and in this case, we're going to try to keep it simple and just say that it's $62,000, just like his salary. In most cases, this number would be different, but we're just going to keep it nice and simple here and use that. Like we said, he's a letter carrier with the USPS, 15 years of service, married with 2 children. Still has the same leg injury, but now he's reached maximum medical improvement. He's gotten his schedule award. Leah, what does that look like to get on disability retirement now?
Yeah, so with a 20% impairment rating, that's pretty significant. Maybe he's not able to deliver mail anymore. And so he can't return to his letter carrier duties. His, letter carrier career is over, and he needs to think about what the next chapter of his life looks like. A lot of times there's not going to be work available with the post office. A lot of those jobs are quite physical. So he can look instead at retirement, through disability retirement specifically. He can apply for disability retirement. He has the years of creditable service. He's got way over 18 months. He has a diagnosis to his leg that's even accepted by workers' compensation and can't return to his position. So let's say he gets approved for disability retirement. On his first year of disability retirement, he will receive approximately 60% of his averaged high 3 salary. Now, keep in mind that there are deductions for things like taxes, federal taxes, health and life insurance if he's continuing those into retirement, but 60% is that main calculation. Second year and every year after on this benefit up until age 62, Jacob is going to receive 40% of his average high 3 salary, again with the same deductions for taxes, health, and life insurance. And then at age 62, he's going to recalculate automatically into regular retirement, but he'll get a boost to his regular retirement where he'll receive the additional years of creditable service. looking at the benefit that specifically Jacob would receive at age 47 to age 62 with that first 60% and then the subsequent years of 40%, I think we're looking at about $384,400 throughout that time period. And again, that's not including the bump he receives to his final retirement benefit.
Yeah, so you can see that this is a significant benefit. Once we just look at the disability retirement annuity and all the benefits that go along with that, over the course of the years that he's on it, it's going to be a significant amount. And then if he's able to go work in the private sector, he could make up to 80% of his old position's current salary while he's working in the private sector and earn even more. So this is a really powerful benefit that not enough federal employees are aware of. And so when we're talking about these things together, what we want you guys to see is that, yes, you might be able to get OWCP workers' compensation. We want you to see that, what's available to you. But we also want you to know about this other thing that could really impact your life and your future. So when we're talking about these benefits together and you look at a disability retirement total potential income on that annuity of $384,400 plus the potential of a schedule award of $51,507. So that total is $435,907 of income. That is a life-changing amount, right? Especially when you're in a really tough position where you've been injured, you're stressed about work, you can't keep working. How am I going to do it? How am I going to make it to retirement? These two benefits together are really powerful. So, Leah, I think a lot of people would come to you for advice on this. What we're trying to say here is, in different scenarios, which direction should we go, right? If I'm available to get these, why would I go on disability retirement? When would I go on disability retirement? How long would I stay on workers' compensation wage loss? When do I get all that? So can you just give us a picture? We know this isn't like specific advice for every person, but just like in general, what people should be thinking about.
Yeah, so as you've said, every case is different. So caveat is it depends on your particular situation, but nothing prohibits you from going after both benefits. A lot of folks that are on workers' compensation, maybe they will be able to return to their federal job, but a very good chunk of them won't. And it's a good idea to think about disability retirement as that safety net for if you get kicked off of workers' compensation. You do have to apply for disability retirement within 1 year of being separated from the federal government. And I think what a lot of employees don't realize is just because you're on workers' compensation receiving those wage loss benefits, it does not mean that they will keep you as a federal employee. You may be separated during that time period without ever returning to work, and that starts your year clock of applying for disability retirement. It's a good idea if you're thinking long term to consider disability retirement as an option and have that as a safety net if you get kicked off of the wage loss benefits or it gets reduced to a point to where disability retirement is more financially beneficial. And at that time, go after your schedule award as well and really maximize your monetary benefits since you can receive both that schedule award and disability retirement at the same time.
Yeah, so just to clarify, I think when you look at workers' compensation, while you're on wage loss, it will pay more than disability retirement. But a lot of people are worried about getting kicked off, like you said, and what's going to happen. There's a lot of anxiety there. Well, what we're saying is you can also be approved for disability retirement at the same time and just keep it on the back burner for when that moment comes that you need to utilize it, and you just switch it right over and you're ready to go, rather than waiting until kind of the last minute when things are really stressful, when you're, either being separated or going back to work or, whatever, that you need this help. Have it ready to go. And that's what we're here for. We want to walk with you through this and take the weight off your shoulders, help explain to you how all these benefits work together. That's why we focus so much on education, is we want federal employees to really understand what their future could look like, kind of how to maximize their benefits to make sure that they're getting what they deserve, getting the most. Ultimately, we don't want to see you risk your future, like you've seen with some of these numbers that we showed here. I know these are just examples, but that's a significant amount of money. And we've seen federal employees receive even more than this. And so all we're saying is don't risk your future, going at it alone. Have a team of trusted and experienced people in this field walk with you through that. So let's just recap the webinar real quick. Leah, what do we need to leave here remembering?
Yeah, we want to remember what your benefits are and to maximize those benefits. For folks that have accepted workers' compensation claims, think about a schedule award if you've got an injury to that accepted body part, and also think about your future with disability retirement if your injury is severe enough to keep you, from going back to your particular position of record. These benefits, overlap with each other. It's important to know that you can qualify for multiple benefits, but there may be some timing as far as which one you receive at any given time. Just to recap, those 3 benefits from workers' compensation: wage loss, medical, and schedule award. The wage loss benefit for lost wages you receive when you can't work. The medical benefits aren't paid to you. The schedule award is that lump sum which you do not want to get until you're off of wage loss benefits. And then disability retirement acts as a safety net if you're approved for that. If you're ever kicked off of wage loss benefits, you might want to switch over to disability retirement. And at that time, go after the schedule award, since you can receive both a schedule award and disability retirement at the same time.
Yeah. Thank you, Leah. We really appreciate you being here and walking through all of this with us. This is what we're here for. Hopefully you can see there's a lot to talk about. There's a lot to discuss, and every situation is different. And so we suggest you give our office a call and set up a free consultation where you can see what your specific situation looks like. Leah, thanks for being on here.
Thank you so much, Nick. It's been a pleasure.
All right. Thanks, Leah. We are going to pass this back over to Elizabeth now, where she's going to give you more direction as we close up the webinar.
Thanks, guys. I know that was a lot of information to cover, and it can be very confusing when thinking about which benefits you can be eligible for and how those could work together. So give our office a call to schedule a free consultation and have our consultation specialist walk you through this process. In the meantime, keep an eye on your email, as we will be sending you a replay of today's webinar that you can watch at any time in case you need a refresher on how these benefits interact with each other. Now, this might be the end of the webinar, but we will still have team members here live answering your questions. So please make sure to get those questions submitted, and they'll answer those as soon as possible. And if we don't end up getting to your question in time, please give our office a call at any time and they can help answer your questions. Again, thank you so much for joining us today, and we'll see you next time on Webinar Wednesdays.